Hello and welcome to Healthcare IT Today, where we explore the latest healthcare technology trends and discover valuable insights in health IT. I'm Colin Hung, and joining me today is Kapil Asher, Head of Healthcare Practice at Contact, a company that makes RTLS solutions. Kapil, welcome to the program.
Thanks for having me. How are you?
I'm looking forward to talking about RTLS. It's not a topic I've spoken a lot about, so I'm excited to dig in here today.
Likewise, I mean, I know that there's a lot of buzz about RTLS. I think breaking it down into different, aspects of what technology is, it's really important for our audience to know.
So why don't we start sort of at ground zero, Kapil? If you could maybe share with us, what is RTLS? What is that technology?
Okay, so RTLS stands for real-time location sensing, right? So everyone is familiar with how GPS works in the real world, right? You have apps like Waze and Google Maps, which are giving you real-time location visibility into resources such as, where your car is parked, where when you're driving from spot A to spot B, how do you get there? Without the real-time location of these resources, you kind of are lost in the real world. So what RTLS does, it kind of brings similar technology within four walls of a building, a big facility like a hospital or a school or a big manufacturing plant, because these are almost small cities and contained within themselves, right? So how do you find resources that are important for your day-to-day work and activity? So RTLS provides you with that location visibility of critical assets, tools or medical devices or resources like nurses, staff members, and it lets you find them in a much faster manner. And then, of course, out of that, a lot of different workflows and efficiencies are driven out of. But at the core and the heart of this technology, it's providing you with real-time location visibility of critical resources.
So if in my head, what I'm getting is a vision of a map of inside of a building, and you can see lots of dots and things on that map. Is that kind of what RTLS will do?
It is exactly what it is. Yeah. So if you ever search for a restaurant on Google Maps, it pops up with multiple pins on that region where you are searching for. RTLS does the same thing. If you're looking for something on a map, it just pops up a bunch of blue dots and tells you where things are of the nature that you're looking for.
So you mentioned a few different ways in your opening there of how people can use RTLS in healthcare, but maybe can you give me an example or three solid examples of how you've deployed this in healthcare?
Absolutely, Colin. So, RTLS is of course, once you open up the possibilities of locating something, people's brains start churning and they come up with some use cases which I would have never thought of in my life. Once you empower someone with the technology, they find creative ways of using it. But I think 80% of our customers use it for medical device tracking. So just specifically talking about healthcare, right? Within hospitals. So imagine it's a hospital that's 1,000 beds. It could span over 1 million square feet, and it could have upwards of 20, 30,000 medical devices, infusion pumps, wheelchairs, stretchers, beds, wound vacs. I mean, the list goes on and on. And while everyone thinks it's trivial to not know where your med devices are at any given time, it's a real problem. So nurses require certain kind of devices to take care of their patients, but when they need one, they don't have one. And when they don't want one, they find them lying around everywhere, right? So how do you kind of provide that visibility to them? So asset tracking. So long story short, asset tracking is our big and most widely deployed use case within the healthcare industry. And we drive some workflows out of that. We provide clinical engineering, biomed folks, the ones who are able to, the ones who are tasked for repairing and making sure the maintenance and upkeep on these devices are going on okay. They get to search for them in a much faster manner. Otherwise, they're just manually rounding up and down the whole hospital, wasting a lot of unproductive time trying to look for equipment. So that's how we find them. Then the second use case I would like to talk about is kind of staff safety and staff duress. So our nurses are obviously one of the most precious resources within hospitals. God bless them. They do a lot of work in this space, much more than I would say physicians and other administrators really do. So kudos to them, and it's kind of our responsibility to keep them safe at all times. So what we've done is we implemented something called a stop duress solution, which is it's like a panic alarm button, which is a wearable. So using the real-time location sensing technology platform and a wearable RTLS badge, we provide them with a panic alarm button. So whenever they feel they are under attack by, let's say a violent patient or a visitor that's just wanting to get more information about their loved ones but are not getting it, and if they feel threatened for their own safety, then they can click this panic alarm button, and through our software we route it all the way to the security who can respond to the situation in a much faster manner. um, when you talk about staff safety, the other element that comes is hand hygiene.
Mm.
So we all understand the hospital acquired infections are a big deal. If a patient comes in for one treatment, but then they acquire another disease from the hospital, then they lose that top line revenue because they are not reimbursed for any hospital acquired infection or cause of making the patient stay in the hospital for a much longer time. And not only patients acquire infections, even nurses acquire infections, right? Because they are in so close contact with the patients. So hand hygiene, keeping your hands clean at all times, which again, it's an obvious thing, everyone should do it, but it doesn't so happen when you're so busy. So we provide with compliancy over there, right? So we have something that detects when hands are washed and how compliant are you with the policies that the hospital has written down. So those protect our staff members. And then finally, the third aspect of RTLS would be patient workflows and experience enhancements, right? So we are in a fast-paced world right now. There is a lot of lessons to be learned from consumer space and how customer experience is valued in hospitality and manufacturing and retail. And we need to bring that over to healthcare also, right? Um, so that means reducing wait times. When you're in a clinic for a simple procedure, you don't want to wait for an hour, 2 hours to even seen by a doctor, right? So we are providing that real-time monitoring of the patient flow. So when the patient comes in, how long they waited in a particular spot, how long the phases of care are taking. If they have some lab work remaining, how long did that take for the lab work to be done? And then identifying the bottlenecks of where the slowness comes out of, right? So with using this real-time data of location visibility of patients and staff, we can help the hospitals with kind of evidence-based data that they can use to change certain things. Like maybe they can hire new staff members, additional staff members. Maybe they can open up a small facility to reduce the bottleneck. Maybe they can reposition their labs in a way that the patients don't have to walk too long to get their labs done. So all of this data ad hoc is one way of doing it, but then when you have evidence, it just becomes solid, and then those decisions become very easy for our CEO, CIO, CFOs to do, right? So those are kind of a very long-winded answer to your question about the three implementations we do.
No, I love it. You talked about asset tracking there at the beginning. You talked about staff safety there. You talked about compliance and an infection sort of application, and then of course now you're talking about patient workflows. Kapil, do you have an example specifically from one of your clients where you've done this and some of the benefits that they've specifically have seen from implementing your solution?
Absolutely. So I can talk about maybe one example per use case. For the asset tracking piece, we have a hospital called Riverside Medical. It's outskirts of Chicago, Illinois, and they implemented kind of the whole real-time location sensing of med devices to benefit their biomed department. This was back in April of 2021. And within 1 year, they've found that they have positive ROI. They were able to improve productivity by at least 1 FTE time, which is not an easy feat to manage in things like this, right? And they were able to reduce their fleet size. So one other aspect of asset tracking I didn't mention earlier was utilization. So when you purchase a fleet of equipment, you want to make sure that every piece of equipment is being utilized at the highest rate possible. But just because of the nature of hospital, that doesn't happen. So let's take infusion pumps, for example. They are utilized only about 30% of the times. So 70% of that of the times that asset is just sitting, gathering dust and not being productive, right? So we have helped Riverside improve their asset utilization by 20-30%. And now they're putting all the equipment they have in use, and they're able to optimize their fleet size and save on some capital expenditure in the future for not having to buy some buffer quantity of equipment. So this has proven to be a very successful deployment for Riverside from an asset tracking perspective. Um, Now from staff Duress, we have I can't name the customer, but we have a Midwestern behavioral health center in the Dakotas, and it's about 150 bed behavioral health center. And as you can imagine, they have violent situations almost on a weekly basis, and we are identifying and creating a response workflow for them in a much faster manner. So things that could have taken more upwards of 3 or 4 minutes before are in a matter of seconds being responded to, right? So in a physical threat situation, every second matters. So we are providing that feature for them right now. And then from a patient workflow standpoint, I again can't express the name of this hospital, but in the Southwest region, we have a big IDN that's using our patient workflow solutions for their clinic.
Mhm.
And clinics are getting more fancy. They are more multidisciplinary. They are not just one single procedure anymore. So they want to make sure that their workflows of patient, different phases of care are being more optimized. And this particular clinic is using our patient bands. They're using our infrastructure to identify where patients are located, and they are improving their wait time. So this and they are able to intake more patients. So once you reduce your wait time, there is more capacity for you to intake more patients. So this particular facility has been able to improve their intake by at least 20% with greater reimbursements and HCAP scores.
Those are fantastic benefits. Those numbers are significant, right? You're talking about the
Yeah,
better asset utilization. You're talking about patient experience and workflow there in the last example. These are all obviously very important things to these healthcare organizations.
absolutely.
Let me ask this question of you, Kapil. As an IT department or someone responsible for IT at my healthcare organization, what are maybe 3 things that I can do to make my RTLS implementation go smoothly? Is there anything I can do beforehand, or is there anything I should do during the implementation?
Absolutely. I think this selection criteria is very important, right? So as an IT department, I'm sure there are a lot of business users like nurses, like the biomed. They are
Mhm.
asking IT for helping with selection of a technology like this, right? So my advice is always to go back to the business users and ask them what is important to you, right? So let's figure out, why do you want RTLS? What is the first 2 or 3 items that will help you benefit in your day-to-day life? If you don't have that charted out in a nice document and have buy-ins from your users, that yeah, this is exactly what we want, then you get completely confused. And there's a lot of garbage information on the internet which you get kind of pulled into. So I would say always talk to your business users, talk to them as a partnership of like, hey, what is important to you, and then go out to select one technology. The other thing I would say is pick a technology that is not very invasive, right, in the day-to-day life. So there's a lot of legacy RTLS out there that still requires you to kind of pull cables and data and PoE drops and all of that. And depending on which market you are in, that is a very expensive labor intake, right? So pick a technology that's easy, that's plug and play, that can leverage your existing network infrastructure and does not make you invest into a completely new one. Because if you are investing in a new network, it's a niche application, a point solution that cannot scale. It'll just stay within that ecosystem. But if you're able to leverage what you have, that can expand beyond you and I can think about, right? So that's always an important thing. Like, think about the technology and how it can scale and how it can't pigeonhole you into one point solution that has no capability of scalability, right? And the uh, third point I would say is like, think about use cases for now, but then also think about use cases that might arise 2, 3, 5 years later on, right? So if your biomed department is talking about asset tracking, which is great, which is a very perfect RTLS use case, but then there are these ancillary use cases which can also be tapped onto the infrastructure. What are those? Interview your business users and ask them, is this a need that you have? And if it is, then kind of think of them both at the same time, and think and use them to spread your ROI, right? So use multiple use cases to spread your ROI, which is what CFOs love all the time listening to, right? Wait, this technology investment is affecting biomed, nurses, patients, everything. We have this ROI that will be provided within 6 months, and it's 3x of what our investment is because of X, Y, and Z use cases. That becomes an easier sell. If you're looking at only one use case, it might not take off as fast as you want it to be. So those are kind of things to look out for.
Kapil, you mentioned that at the top of your answer there, there are lots of solutions or different types of RTLS solutions out there. What makes Contact stand out from those others?
So Colin, you're right. RTLS market is getting a bit overcrowded. There have been a few legacy players that have dominated the space for the past 10 years, but the reality is these companies are facing some serious lack of innovation and modernization. What I mean by that is these systems are hard to install because of how invasive their devices are. You need power and data cable pulls. You need an on-site server, some highly skilled technicians to go on-site and perform system tuning. I mean, the implementation fee alone is not affordable for all segments of the market, right? So that's why RTLS adoption has stagnated to about 30% of the hospitals in the world. Now, this is where Contact IO differentiates itself. We have designated a simple plug-and-play system, which is delivered in a box and can be installed by anyone. And I truly mean anyone, right? We do not require special cabling or skilled engineering time to install and test our systems. Using the power of infrared technology, machine learning, and AI, our system provides room level accuracy with absolutely no manual intervention or tuning necessary. In most cases, we don't even send a technician on site, and everything is done kind of DIY and with our remote engineering support. Also, since we are hosted in the cloud, hospitals don't need to spend a lot of money and a lot of time and dollars in provisioning and maintaining an on-site server. And finally, we are the only players in the market that utilize open source BLE and Wi-Fi protocols, which opens up opportunities to leverage existing hospital networks. And not only that, it helps you incorporate other IoT sensors that Contact IO does not develop, but they address a specific niche use case within healthcare, right? So we can bring them onto our ecosystem. And this is something legacy RTLS companies cannot do because of how proprietary their networks are, and because of that monopolistic nature of their system.
Kapil, you've shared a lot of information with us today. Thank you very much. Where can people go to find out more information about Contact?
Yeah, so our website is www.contact.io. So I'll spell that out for you. It's KONTAKT.io. So just replace your regular word contacts with K instead of C's. And then we are found on LinkedIn. We are on Twitter. We have a forms-based method of getting into talking to salespeople. You can find me on LinkedIn as well. My name is Kapil Asher, and ping me, and I'm happy to talk to you about it as well.
Well, Kapil, thank you so much for being on our program today and for answering my questions about RTLS.
Thank you. It was a pleasure.
If you enjoyed this interview as much as I did, we'd love for you to subscribe, rate, and give a review on iTunes, YouTube, or wherever you're listening and watching. Also, head on over to healthcareittoday.com to access free resources, industry news, and insightful articles. You can also connect with us on Twitter using the hashtag HITSM. I'm Colin Hung, along with Kapil Asher. Thanks for being here.
Thank you.